1. Which of the following best demonstrates the role of a certified documentation improvement practitioner, CDIP, in aligning documentation with adult learning principles during physician education? A. Creating documentation templates without physician input. B. Delivering memorized compliance regulations in long lectures. C. Using case-based scenarios to illustrate documentation requirements. D. Relying on email reminders to enforce documentation accuracy. 2. When evaluating the effectiveness of a CDI program, which method provides the strongest measure of success? A. Number of coding queries issued. B. Percentage of improved reimbursement rates. C. Quality metrics improvement linked to clinical documentation. D. Frequency of staff attendance in CDI meetings. 3. A CDI professional is tasked with mentoring a new physician on documentation accuracy. Which approach aligns best with adult learning principles? A. Correcting the physician publicly during a meeting. B. Encouraging the physician to reflect on a past case and how documentation affected patient care. C. Providing a detailed manual of compliance regulations to study independently. D. Repeating the same lecture until the physician improves. 4. Which evaluation method would be most effective to determine if CDI staff correctly apply new query guidelines? A. Multiple choice knowledge test only. B. Direct observation with real-time feedback. C. Written self-reflection by staff. D. Attendance logs from training sessions. 5. In curriculum development for CDI training, which element ensures alignment with adult learning theory? A. Designing long didactic presentations. B. Incorporating interactive case studies. C. Using only compliance-focused PowerPoints. D. Limiting opportunities for questions. 6. Which of the following communication strategies is most effective for engaging resistant physicians in documentation improvement? A. Presenting punitive consequences for poor documentation. B. Using collaborative discussions centered on patient safety outcomes. Sending generic compliance reminders by email. D. Avoiding follow-up to reduce conflict. 7. A CDI team develops a mentoring program. What is the most critical first step? A. Drafting an evaluation rubric for mentors. B. Identifying measurable outcomes for the program. C. Selecting mentors based solely on seniority. D. Implementing the program immediately without planning. 8. A CDI practitioner is creating an evaluation tool for training. What characteristic makes the tool most valid? A. Measuring staff satisfaction only. B. Assessing knowledge, skills, and application in practice. C. Counting the number of slides viewed in training. D. Asking vague questions about improvement. 9. Regulatory compliance requires CDI practitioners to ensure which of the following in physician queries? A. Leading physicians to a preferred diagnosis. B. Use of open-ended, non-leading language. C. Incorporating billing targets into the query wording. D. Prioritizing speed of completion over clarity. 10. Which scenario best illustrates the application of adult learning principles in CDI mentoring? Encouraging learners to apply documentation concepts to real patient cases. B. Delivering identical presentations to all learners regardless of specialty. C. Enforcing compliance through standardized memos. D. Avoiding case-based discussion to save time. 11. What is the most effective evaluation method for determining whether CDI interventions improved patient safety metrics? A. Conducting staff opinion surveys. B. Comparing pre- and post-intervention data on safety indicators. C. Counting the number of CDI queries issued. D. Measuring length of training sessions. 12. When developing a CDI curriculum, why is a needs assessment essential? A. To satisfy accreditation requirements only. B. To tailor education to learners' existing knowledge and practice gaps. C. To reduce the amount of content that must be developed. D. To ensure the training sessions are shorter. 13. What is the primary communication barrier in CDI efforts with physicians? A. Lack of awareness of clinical terms. B. Physician perception of CDI as purely financial. C. Limited access to clinical documentation software. D. Too many training materials. 14. A CDI mentor evaluates a new practitioner. Which feedback style is most consistent with effective mentoring? A. Immediate, specific, and supportive feedback linked to goals. B. Delayed feedback given weeks later to avoid conflict. C. General praise without pointing out areas for growth. D. Critical comments delivered in a public setting. 15. When designing a CDI evaluation tool, which type of validity ensures the tool measures documentation accuracy? A. Content validity. Face validity. C. Predictive validity. D. Construct validity. 16. Which of the following best illustrates regulatory compliance in CDI? A. Ensuring all documentation queries are tracked and auditable. Allowing undocumented verbal agreements to support claims. C. Modifying physician notes without notification. D. Prioritizing reimbursement over compliance. 17. What is the most appropriate way to evaluate the effectiveness of a CDI communication workshop? A. Administering a post-workshop test on communication strategies. B. Observing participants apply communication techniques in practice. C. Tracking attendance records. D. Counting the number of slides in the workshop. 18. In mentoring a CDI novice, how can the mentor apply adult learning theory? A. Allowing the novice to self-direct learning through case-based exploration. B. Requiring the novice to memorize regulations without context. C. Avoiding questions to maintain control of the session. Delivering only one-way lectures. 19. Which of the following demonstrates a CDI practitioner's role in curriculum development? A. Reviewing outcomes to adjust training modules based on learner performance. B. Delivering identical modules each year without modification. C. Avoiding evaluation of learner outcomes. Ignoring adult learning needs during planning. 20. A CDI program is being evaluated for return on investment (ROI). Which data point best supports the evaluation? A. Number of queries written by CDI staff. B. Financial performance improvement linked to compliant documentation. C. Hours spent in CDI training sessions. D. Physician attendance at educational workshops. 21. Which communication method would most likely foster collaboration between CDI staff and physicians? A. Engaging in two-way discussions about how documentation impacts patient outcomes. B. Sending policy reminders with no context. C. Reprimanding physicians for incomplete documentation. D. Avoiding conversations about clinical care. 22. A CDI mentor notices a mentee struggles with query compliance. Which intervention is most effective? A. Reviewing case examples and practicing compliant queries together. Reprimanding the mentee in front of the team. C. Providing only written policies with no discussion. D. Ignoring the issue until performance reviews. 23. In curriculum development, which strategy ensures regulatory compliance is taught effectively? A. Embedding compliance principles into case-based scenarios. B. Avoiding compliance to focus on clinical content only. C. Limiting teaching to a list of compliance terms. D. Presenting compliance as optional material. 24. A CDI practitioner wants to evaluate communication effectiveness during physician training. Which measure is best? A. Physician satisfaction survey results only. B. Improved accuracy in physician documentation after training. C. Number of emails opened by physicians. D. Length of physician training sessions. 25. Which of the following is the most effective way to align CDI staff mentoring with evaluation principles? A. Using performance metrics to track mentee progress over time. B. Relying on subjective impressions only. C. Avoiding follow-up after mentoring. Providing generic feedback unrelated to goals. 26. Which is the best method for evaluating whether adult learners retained CDI knowledge over time? A. Long-term follow-up assessments with applied case studies. B. Counting attendance in training. C. Asking learners to sign an acknowledgement form. D. Tracking the number of queries issued. 27. What role does feedback play in effective CDI communication with physicians? A. Encourages continuous improvement and builds trust. B. Serves as a punitive measure to enforce compliance. C. Provides only general reminders without specifics. D. Avoids difficult conversations to reduce conflict. 28. Which principles should guide the design of CDI training for experienced physicians? A. Focusing on problem-centered practice-based learning. B. Delivering long theoretical lectures. C. Assuming all physicians have the same learning needs. Prioritizing content quantity over relevance. 29. A CDI team develops an evaluation plan for their program. Which method is most comprehensive? A. Measuring knowledge, practice changes, and outcomes over time. B. Recording staff training attendance only. C. Relying solely on financial metrics. D. Counting the number of queries sent. 30. Which of the following best demonstrates compliance with AHIMA CDI Query Practice Brief Guidelines? A. Queries should never suggest a specific diagnosis. B. Queries should always be closed-ended for efficiency. C. Queries may direct physicians toward higher reimbursement codes. D. Queries should be avoided if uncertain.